This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I'm Abhishek Mukhopadhyay and with me is Sarabjit Kaur. The headlines. Prime Minister Narendra Modi to review progress in containing COVID-19 with Chief Ministers this afternoon. Railways to resume passenger train services from tomorrow. Booking of tickets opens online at 4 p.m. today. No fresh case of COVID-19 in 10 states and union territories in the last 24 hours. Special flights bring stranded Indians back home from US, UK, Philippines and Saudi Arabia. Indian naval ship INS Magar carrying around 200 Indian nationals leaves for Kochi in Kerala from Maldives. And the National Institute of Virology develops country's first indigenous antibody-based testing kit, COVID Kavach ELISA, for diagnosis of coronavirus. Prime Minister Narendra Modi will hold a meeting with the state chief ministers through video conferencing this afternoon. Mr. Modi will review country's progress in containing the coronavirus pandemic. Discussion on further relaxations to boost economic activities is likely to take place. The meeting will be attended by Home Minister Amit Shah, Finance Minister Nirmala Sitharaman, Health Minister Harsh Vardhan and some senior officials. More from our correspondent.
This will be the Prime Minister's fifth video conference with the Chief Ministers since the announcement of nationwide lockdown in March. As the country enters into the last week of its third phase of lockdown, the meeting is very crucial in terms of finalizing the roadmap ahead. In his monthly radio address, Man Ki Baat, last month Prime Minister said the country is in the middle of a war and asserted that people have to continue being careful and take precautions. His note of caution came amidst gradual exemptions being granted by the centre and states to revive economic activities. Few state governments' demand regarding visiting the idea of demarcating red, orange and green zones is high on the table. Decision over measures to further boost up economic activities and address migrant worker issues is as well on the agenda of this meeting. Prime Minister's this meet yet again stamps his belief of inclusive decision-making where views of all stakeholders are necessarily considered. Anand Chaturvedi, AIR News, Delhi.
Indian Railways has announced gradual restart of passenger train services from tomorrow. Initially, 15 pairs of trains will ply with passengers on board. These trains will be run as special trains from New Delhi station, connecting Debrigarh, Agartala, Howrah, Patna, Bilaspur, Ranchi, Bhubaneswar, Sikandarabad, Bangalore, Chennai, Tiruvananthapuram, Madgaon, Mumbai Central, Ahmedabad and Jammu Tawi. Our correspondent has the details.
Booking for reservation in these special trains will start at 4 p.m. today and will be available only on the IRCTC website. Ticket booking counters at the railway stations shall remain closed and counter tickets will not be issued. Only passengers with valid confirmed tickets will be allowed to enter the railway stations. Passengers will have to wear face cover and only asymptomatic passengers will be allowed to board the train. Railways will start more special services on new routes. 20,000 coaches have been reserved as COVID-19 care centers and adequate number of coaches are also kept reserved to enable operation of up to 300 trains every day as Shramik Special for stranded migrants. With Dipendra, Suparna Saikya, AIR News, Delhi.
Union Health Minister Harsh Vardhan has said that no COVID-19 case has been reported in 10 states and union territories in the past 24 hours, asserting that India is moving fast on the path of success in the fight against the pandemic. He said recovery rate has improved to 30.7%.
पिछले 3 दिन का जो डबलिंग रेट है वो 12 है। रिकवरी रेट आज 30% से ऊपर पहुंच गया है। 60,000 में से लगभग 20,000 मरीज ठीक होकर वापस अपने घरों में चले गए हैं और मोर्टेलिटी रेट अभी भी केवल 3.3% बना हुआ है। यद्यपि एक भी मृत्यु होती है तो वो बहुत कष्टदायक होती है। पिछले 24 घंटे में 10 स्टेट्स और यूनियन टेरिटरीज ऐसे हैं जहां एक भी केस नहीं आया है।
According to Health Ministry data, 1,511 COVID-19 patients recovered in the last 24 hours, the highest number of recoveries recorded in one day. Dr. Harsh Vardhan said 4 states and union territories have never reported any corona case since the outbreak. The statement comes after the health minister inspected arrangements at a COVID-19 care center in Mandoli area of the national capital. In Himachal Pradesh, people returning from other states will have to stay under institutional quarantine. State government has decided that residents of Himachal coming from Punjab, Maharashtra and other red zone areas of the country will be tested for COVID-19. On the other hand, special trains will be operated for the movement of stranded residents of the state from Bengaluru and Goa to Una. Chief Minister Jairam Thakur said that adequate arrangements have been made at the Una railway station for ensuring proper social distancing. We have a report.
So far, 17 active COVID-positive cases have been registered in the state. In view of increasing cases of COVID-19, the state government has decided that all those who are returning from other states would have to stay under institutional quarantine before sending them to their respective districts. Meanwhile, all the nodal officers have been asked to redress the query of the stranded person on priority and keep close liaison with nodal officers of other states in bringing back the residents. According to the state government, 52,763 people of the state stuck at various parts of the country have applied for COVID e-pass. Priority would be given to students for bringing them back. To evacuate stranded people, a special train would start from Bengaluru to Una today, while a special train from Goa to Una would start on 13th or 14th of this month. Sanjeev Sundariyal, AIR News, Shimla.
In Gujarat, the total number of COVID-19 cases has gone up to 8,195 with 398 new cases reported during the past 24 hours. According to health officials, 21 patients have lost their lives during the last 24 hours, taking the total death toll of COVID-19 in the state to 493. In an online briefing, Principal Secretary of State Health and Family Welfare Department, Dr. Jayanti Ravi, said the patient discharge rate has increased to almost double during the last 10 days. More from a correspondent.
Doubling the patient's discharge rate is a big relief to the state when the numbers of new patients are increasing alarmingly since last few days. Maximum 266 patients have been discharged from Ahmedabad city alone, while 41 patients discharged from Vadodara. According to Health Department sources, Gujarat has improved its patient discharge rate from 15.58% to 32.64% during the last 10 days. New discharge rate is not only higher than half a dozen states but also above the national average. After the discharge of total 2,545 patients, the state has now 5,157 active COVID-19 cases. Yogesh Pandya, AIR News, Ahmedabad.
Maharashtra continues to be the worst affected state with the highest number of COVID-19 cases. Details on this from a Mumbai correspondent.
Maharashtra has reported 1,278 new COVID-19 cases and 53 deaths yesterday. With this, the state's tally of COVID-19 cases count reached to 22,171, while total number of fatalities is now 832. According to State Health Department, of the 53 deaths yesterday, 19 were reported from worst hit Mumbai, setting new record as many as 875 people testing coronavirus positive from Mumbai yesterday. With this, the number of such patients in Mumbai city surged to 13,564. On a positive side, the state government has so far discharged 4,199 patients of COVID-19 after recovery. Nivedita, AIR News, Mumbai.
Tamil Nadu witnessed 669 new COVID-19 cases yesterday, taking the total to 7,204. More than 13,000 tests were done on a single day. 135 patients were discharged yesterday, while 3 more people died of the disease, taking the death toll to 47. Our correspondent has filed this report.
A raft of relaxations from the lockdown conditions come into effect in Tamil Nadu from today. All private firms and shops selling essential items and standalone shops can function for extended hours due to the easing of norms. Meanwhile, officials in Chennai have exuded confidence that the current spell of continued spike in the COVID-19 cases in the city will soon stabilize and then decline. They say the numbers show a surge consistently for the past few days due to the fact that focused testing is being carried out in the areas where there are more concentrations of positive cases. And once the clusters are all covered fully with the testing, the situation would vastly improve. The State Revenue Commissioner Dr. J. Radhakrishnan told reporters yesterday, all those infected with SARS-CoV-2 virus need not be considered as full-blown COVID-19 patients. Jai Singh, AIR News, Chennai.
Special Air India flights have brought many stranded Indians back home from the United States, United Kingdom, Philippines and Saudi Arabia during the last few hours. The exercise is a part of the world's largest evacuation operation, Vande Bharat mission by the Government of India to bring back stranded Indian nationals from different countries due to COVID-19 outbreak. The first Air India special flight from San Francisco in US has brought 225 Indians to Mumbai. Another Air India flight carrying Indians landed in Mumbai from Manila, the capital of the Philippines. In a tweet, External Affairs Minister Dr. S. Jaishankar thanked Air India, the Ministry of Civil Aviation, Maharashtra government and others for support and coordination in this regard. An Air India flight brought several Indian nationals from London to Bengaluru. Another Air India flight from Riyadh in Saudi Arabia brought back 139 Indians in Delhi. A special flight with 171 stranded Indians on board reached Chennai last night from Kuwait. The first phase of operation under Vande Bharat mission began on 7th of this month and will continue till 15th of this month. On the 5th day of the mission today, 2 flights from UAE and 1 flight from Bahrain will see the return of over 500 passengers to India. More from our West Asia correspondent.
More than 500 distressed and anxious Indians waiting to board the flight from UAE and Bahrain. From Abu Dhabi, there is a flight scheduled for Hyderabad. From Dubai, yet another flight to Kochi with approximately 177 distressed Indians. And from Bahrain, 1 flight to Kozhikode with approximately another 180 people. Efforts are being made to give priority to workers who have lost their jobs, medical emergency cases, pregnant women, and some who are stranded for other reasons. Only those who are found asymptomatic will be allowed to board the flight for India. Kanchan Prasad, AIR News, Dubai.
The second phase of evacuation exercise under Vande Bharat mission is expected to begin from 16th of this month.
As part of the Samudra Setu program, second ship of Indian Navy has left for Kochi in Kerala from Maldives. More from a correspondent.
INS Magar is expected to reach Kochi by tomorrow evening carrying 202 Indian nationals including 24 women and 2 children. One of the person had a fractured leg and special arrangements were made for his safe embarkation and travel. All safety precautions were in place as the evacuees were screened medically and their baggage disinfected before journey commenced. Earlier, INS Jalaswa had reached Kochi yesterday bringing back 698 people from Maldives. Both ships, part of Samudra Setu program, are scheduled to return to Malé for further evacuation and next lot of people are expected to be ferried to Tuticorin in Tamil Nadu. Santosh Kumar for AIR News from Colombo.
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi to review progress in containing COVID-19 with Chief Ministers this afternoon. Railways to resume passenger train services from tomorrow. Booking of tickets opens online at 4 p.m. today. No fresh case of COVID-19 in 10 states and union territories in last 24 hours. Special flights bring stranded Indians back home from US, UK, Philippines and Saudi Arabia. Indian naval ship INS Magar carrying around 200 Indian nationals leaves for Kochi in Kerala from Maldives. And National Institute of Virology develops country's first indigenous antibody-based testing kit, COVID Kavach ELISA, for diagnosis of coronavirus. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें: डीडी 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
National Institute of Virology in Pune has developed country's first indigenous antibody-based ELISA test kit, COVID Coverage for diagnosis of novel coronavirus. This kit is expected to change the dynamics of COVID-19 testing in the country. The kit has displayed high sensitivity and accuracy in the validation tests at different sites. It can test around 90 samples in approximately 2.5 hours. In a tweet, Union Health Minister Harshvardhan said that ELISA-based testing can easily be operated even at district level. He informed that the technology has been transferred to pharmaceutical manufacturing companies for mass-scale production. In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and mythbusters. The government has dismissed a WhatsApp message claiming that Ayushman-yojana.org is the official website of Ayushman Bharat Yojana. In a tweet, Press Information Bureau described it as false. It said the National Health Authority has clarified that www.pmjay.gov.in is the only official website of Ayushman Bharat Yojana.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, President of Indian Medical Association, Dr. Rajan Sharma said that citizens need to follow basic hygiene and social distancing norms, especially when government has allowed a set of relaxations in the third phase of lockdown.
3 चीजें, फिजिकल डिस्टेंसिंग, रेस्पिरेटरी एटिकेट्स, यानी कि कहीं खांसते रुमाल रखें और मास्क डाल के रखें, नहीं तो गमछा। और तीसरा, अपने और अपने आसपास की जगह को साफ। ये 3 मूल मंत्र हैं जो सदियों से चले आ रहे हैं किसी भी हॉस्पिटल में। और अब सरकार जिस तरह कर सकती थी, सरकार ने कर दिया है। लॉकडाउन में आपको एहतियात कर दिया है। अब इसके बाद जो आने वाला समय है, हम सबको भारतीय बन के इन सारे मापदंडों में खरा करना है, भीड़ भाड़ नहीं करनी है, जितना जरूरत है उतना सामान लेना है, जितना जरूरत है उतना बाहर आना।
Speaking to AIR News, Dr. Rakesh Misra, Director of Center of Cellular and Molecular Biology, highlighted the importance of growing cultures of the virus in labs for developing vaccines and conducting serological tests.
We also have started growing the virus in the cell in the laboratory, which is very important technology platform for several things. One is vaccine preparation, so you can grow a lot of virus, inactivate it and use it as vaccines. Then second thing is these are growing in the cell, so you have a cell culture system where you can test a drug. So add a drug and virus growth is stopped, which means it's an antiviral against COVID-19. So that is the in vitro assay system. Not many places have that. And also, since the virus will be in our hand in larger quantity, we can do serological testing, use them as an antigen to test the plasma of recovered patients, whether they have antibody against the virus, so that plasma can be used for plasma therapy.
Department of Biotechnology and Biotechnology Industry Research Assistance Council, DBT BIRAC Research Consortium, has recommended 70 proposals for funding in vaccines, diagnostics, therapeutics and other technologies. The shortlisted proposals includes 10 vaccines candidates, 34 diagnostics products, 10 therapeutics options, 2 proposals on drug repurposing and 14 projects which are categorized as preventive interventions. Science and Technology Ministry said to urgently develop safe and effective biomedical solutions against SARS-CoV-2, DBT BIRAC had invited applications for COVID-19 Research Consortium.
Hyderabad-based Defence Research and Development Organization DRDO Lab has developed automated ultraviolet systems to sanitize electronic gadgets, papers and currency notes. Defence Ministry said the device, Defence Research Ultraviolet Sanitizer, DRUVS, has been designed to sanitize mobile phones, iPads, laptops, currency notes, check leaves, challans, passbooks, paper and envelopes. Bundles of currency notes can be sanitized using DRUVS. The DRUVS is having contactless operation, which is very important to contain the spread of virus. In Madhya Pradesh, the number of coronavirus cases in the state rose to 3,614. Thus, the number of affected districts has gone up to 39 in Madhya Pradesh. The condition of 1,480 patients is stable, while that of 243 was serious. So far, 1,676 people have recovered from the coronavirus infection, while 215 have died. Meanwhile, after Radio School, Doordarshan Classroom is starting in Madhya Pradesh from today. We have a report.
The special educational program Doordarshan Classroom is being produced by School Education Department in collaboration with Doordarshan. The program aims to provide study material to the students of the state's higher classes so that they can study regularly at their home during the lockdown period. This program is designed on thematic concepts for 10th and 12th classes. It will also include interesting videos on difficult concepts of the subject over a period of 1 hour. The program will air twice a day from Monday to Friday on every week. Programs will be broadcast every day from 12 to 1 p.m. for class 10th and 3 to 4 p.m. daily for class 12th. The School Education Department is already airing the Radio School through All India Radio. Sanjeev Sharma, AIR News, Bhopal.
In Uttar Pradesh, production work at the famous sports equipments industry of Meerut has started again after relaxation in lockdown. Our correspondent reports that corona effect and change in the lifestyle is reflecting in the orders coming to the industry since indoor games equipments are now in high demand.
Coronavirus has changed the lifestyle of humankind worldwide, and people are now focusing more on indoor games and fitness activities. The trend, which is reflected in the orders coming to the sports equipment industry of Meerut, which has started work again after almost 2 months. Rakesh Kohli, chairman of Stag International, a company famous for making table tennis equipments, told AIR,
वर्क फ्रॉम होम के साथ साथ हर आदमी अपनी फिटनेस के ऊपर कुछ ना कुछ करना चाहता है. जितने भी लोग इंडोर गेम्स के व्यवसाय से जुड़े हुए हैं, उनका व्यवसाय आने वाले टाइम में बढ़ेगा. अगर आप आंकड़ों की बात करें तो करीब फिटनेस में ही जो है 190% की इंक्रीज है इन द लास्ट 3 months फॉर इंडोर फिटनेस इक्विपमेंट.
Production work has started at almost 500 out of around 3,000 units of the sports industries of Meerut, which supplies fitness and sport equipments to the world. Social distancing norms are being followed religiously at these units.
सोशल डिस्टेंसिंग भी काफी हद तक मेंटेन थी, लेकिन अब तो एक जिंदगी का नॉर्म बन गया. बिना सोशल डिस्टेंसिंग के तो कोई काम चलना ही नहीं. इसलिए अब हमने 25-40% लोगों के साथ ही फिलहाल काम शुरू किया है.
With Sangeeta Srivastava in Meerut, Sushil Chandra Tiwari, AIR News, Lucknow.
Sports Authority of India, SAI, has formed a committee to prepare a standard operating procedure to resume training in all SAI centres in all sporting disciplines after the lockdown is lifted. All training had been suspended across SAI centres in view of the ongoing corona pandemic. A separate committee has been formed to prepare a standard operating procedure for swimming, since the sport requires athletes to train in water and may have different health risks involved as compared to other sport. The recommendations of the committees are being made in consultation with respective national sporting federations and other stakeholders and will be sent to the Sports Ministry for final approval.
Renowned actor Akshay Kumar has appealed to people to stay at home and follow all guidelines regarding lockdown to save themselves and the family from coronavirus.
बीमारी के सामने सबकी हालत बुरी है, पूरी दुनिया की हालत बुरी है. अपने परिवार के हीरो बन सकते हो तुम लोग, जिंदगी के खिलाड़ी बनो. सिर्फ घर पे रहो, बस घर पे रहो, बस सिर्फ घर पे रहो. जब तक सरकार कह रही है घर पे रहो, इससे आपकी जान बची रहेगी, आपके परिवार की जान बची रहेगी. कोरोना के खिलाफ जंग छिड़ चुकी है, हमें इसे हराना है, इस डिजीज को हराना है.
The News Services Division of All India Radio in his bilingual live phone-in program tonight will bring you a special discussion program on COVID-19. Dr. Balwinder Singh, senior physician at Safdarjung Hospital, will participate in the discussion. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. Listeners can ask questions to the expert on toll-free telephone number 1800115767. You can also ask questions on telephone number 011-2331-4444 and post queries on a Twitter handle at AIR News Alerts by #AskAIR.
National Technology Day is being celebrated today with the focus on rebooting the economy through science and technology. The conference will bring together scientists, technocrats, diplomats, WHO officials and dignitaries from national and international industry, research institutions and academic institutions. Science and Technology Ministry said, in the COVID-19 crisis, technology has been at the forefront of the battle against the pandemic. Keeping in mind the need of the hour to formulate a comprehensive action plan to reboot the economy, Technology Development Board is celebrating the day, focusing on technological solutions towards that end. Prime Minister Narendra Modi has commended the efforts of scientists and all other people who are leveraging technology in the country. In a tweet, Mr. Modi said, the nation salutes endeavours of all those who are bringing a positive difference in the lives of others through means of science and technology. The Prime Minister, making a reference to the tests in Pokhran in 1998, remembered the exceptional achievement it made. He said the test at Pokhran was a landmark moment in India's history, and it also displayed the changes which a strong political leadership can bring in the country. Prime Minister said that technology is helping many in the efforts to make the world free from COVID-19. He thanked all those at the forefront of research and innovation on ways to defeat the coronavirus. Mr. Modi also said that we should aim at creating a healthier and better planet through the use of technology. In his Mann Ki Baat program, Prime Minister had said that
मई 1998 का महीना देश के लिए सिर्फ इसलिए महत्वपूर्ण नहीं है इस महीने में परमाणु परीक्षण हुए, बल्कि वो जिस तरह से किए गए वो महत्वपूर्ण है। इसने पूरे विश्व को दिखाया कि भारत की भूमि महान वैज्ञानिकों की भूमि है और एक मजबूत नेतृत्व के साथ भारत नित नए मुकाम और ऊंचाइयों को हासिल कर सकता है। अटल बिहारी वाजपेयी जी ने मंत्र दिया था, जय जवान, जय किसान, जय विज्ञान। आज जब हम 11 मई 1998 उसका 20वां वर्ष मनाने जा रहे हैं, तब भारत की शक्ति के लिए अटल जी ने जो जय विज्ञान का हमें मंत्र दिया है, उसे आत्मसात करते हुए आधुनिक भारत बनाने के लिए, शक्तिशाली भारत बनाने के लिए, समर्थ भारत बनाने के लिए हर युवा योगदान देने का संकल्प करें।
Several parts of the country are likely to receive light to moderate rain with instances of thunderstorm activities at isolated places this week. Indian Meteorological Department IMD said North India is likely to witness light to moderate rainfall this week due to two western disturbances that will bring precipitation and thunderstorms to the hills and the plains. The weatherman has forecast cloudy sky in the national capital today with possibility of light rain. The minimum temperature in the city will be 26 degrees Celsius, while maximum temperature is expected to be 37. However, in Mumbai, sky will be mainly clear today. In Chennai, the temperature will hover between 28 to 37 degrees Celsius and the sky will be generally cloudy. And in Kolkata too, sky will be partly cloudy and there is also possibility of moderate rain or thunderstorm. In the Union Territory of Jammu and Kashmir, the minimum temperature will be 22 degrees in Jammu, while maximum will be around 35 degrees Celsius. In Srinagar, sky will be partly cloudy with possibility of rain or thunderstorm or dust storm. In Gilgit, the temperature will hover between 12 and 22 degrees Celsius and the sky will be partly cloudy. And in Muzaffarabad, sky is likely to be cloudy and there might be light rain today. The minimum temperature will be 20 degrees Celsius while the maximum will be nearly 31.
And now an overview of today's newspapers. Trains to restart tomorrow. Bookings open online today, leads Hindustan Times, adding Delhi to be connected with 15 destinations, strict guidelines for passengers. PM to talk with CM's COVID lockdown road ahead today, informs the Pioneer. The paper says that resumption of public transport, dilution of curbs likely on agenda. 75% COVID patients in Delhi are asymptomatic or have mild symptoms, says Kejriwal, writes the Statesman. Norms issued for restart of industrial units, says the Hindu. The paper quotes NDMA as saying first week is test run period. And finally, the Times of India reports that amid privacy worries, Arogya app set to enter 100 million users club.
And now, before we end the special news program on COVID-19, the headlines once again. Prime Minister Narendra Modi to review progress in containing COVID-19 with chief ministers this afternoon. Railways to resume passenger train services from tomorrow. Booking of tickets opens online at 4 p.m. today. No fresh case of COVID-19 in 10 states and union territories in the last 24 hours. Special flights bring stranded Indians back home from US, UK, Philippines and Saudi Arabia. Indian naval ship INS Magar carrying around 200 Indian nationals leaves for Kochi in Kerala from Maldives. And the National Institute of Virology develops country's first indigenous antibody-based testing kit, COVID Kavach ELISA, for diagnosis of coronavirus. And with that, we end the special news program on COVID-19.